Hi, this is Dr. Matt Wynia again from the University of Colorado Center for Bioethics and Humanities. And this is part two of our three-part sort of mini-series on navigating ethical challenges in public health emergencies. So I'm going to share my screen here. And today we're going to be talking about restrictions on liberties. So you may recall these disclosures are the same as for the first presentation. This is funded by ASPR, and I don't have any conflicts of interest to disclose. You may recall last time I said a word about sort of three categories of ethical issues in disaster response. The first one we talked about was around the duty to treat, the responsibility to continue caring for patients despite personal risk, and how do you weigh responsibility to yourself and your family and responsibility to your professional duties and to caring for patients when they may pose a threat to you. The second one we're going to talk about today is restrictions on liberty. These are things like quarantines, mandates, business closures, etc. And then the third one will be on resource allocation dilemmas. So the key points I want to make today are restricting liberties in a public health emergency can be effective, but they must be ethically and legally justified, because we have clear historical examples where they have been taken too far and where they have backfired. And the result of that is that this is a complex calculus. Making decisions about whether to implement restrictions on individual and group liberties really requires a good understanding of a variety of different things. And that means there is a special responsibility of health professionals who have a grasp on some of those things better often than politicians, for example, might. So there is a special responsibility that we have to inform these policy decisions. So let me start with this. Maybe this is obvious to you all, but restricting liberties can be effective. So for example, in this BMC public health piece, it looked at when lockdowns were implemented and the effectiveness of those lockdowns. And the bottom line is, lockdowns worked. They prevented the more rapid escalation of COVID in cities around the world, from India to South Africa to Spain to Italy. This is, a worldwide survey of cities that implemented lockdowns at one time or another. And looking back historically, we've got a number of childhood illnesses where vaccine mandates were implemented. And you can see on the thing here, these little lines are when the mandate was implemented. You can see, the impact of a vaccine mandate is extremely strong. These diseases often went literally to zero cases after vaccination was mandated. So that is clearly a restriction on liberty, and it clearly works. The problem is, of course, restricting liberties is a strong power. And there was a time in the 1980s when a number of countries around the world had dictators that essentially used ostensible threats to the public to implement lockdowns that were political in nature and not really justified. These were, sort of political strongmen using these as ways of controlling a population. So the UN in the early 1980s, 1984, I believe, put together what are called now the Syracuse Principles. And they basically said coercive actions in public health need to be legitimate, so scientifically justified, legal, necessary, meaning they are not excessive or overly broad, and non-discriminatory. And this necessary piece is, as I said, sort of parameterized by saying you need to use the least restrictive means appropriate to the reasonable achievement of a legitimate public health goal. You'll notice, by the way, that this is very similar to the civil liberty protections that we have in the United States under the US Constitution, where our 5th and 14th Amendments guarantee due process and equal protection. And the way the Supreme Court and other courts generally interpret that is the state may restrict individual liberties, but only if there's a compelling state interest in doing so, if the intervention is well targeted, if it is the least restrictive means necessary, and if there's due process. So these are widely agreed parameters on when it's okay to restrict liberties. The federal government has specific restrictions on what it can do. Federal forces are not allowed within the states unless the states invite them in. And that's by both the Insurrection Act and the Posse Comitatus Act. You'll hear those talked about sometimes. And then the Stafford Act is what really provides the parameters under which a governor requests assistance from the state. The president declares a public health or other disaster, and FEMA is the responding agency. So there's a very strict delimiting, basically, of what the federal government can do. By the Constitution, the federal government can regulate interstate commerce, national defense, and they have the power of the purse, tax and spend. But all the powers that are not explicitly given to the federal government are reserved for the states, which means largely public health law and public health police powers within that are state issues. They are not federal issues. The feds cannot implement a national vaccine mandate, for example, despite some of the rhetoric around this. That's actually not within the purview of the feds, and no one really talks about that even. But states do have police powers. They can act to protect public health, welfare, and morale. And these emergency police powers include things like surveillance, mandated reporting, epidemiology investigations, where you have to answer their questions. They can seize your property. They can require vaccinations. They can require treatments. They can require quarantine, isolation. They can close businesses, etc. And the question I want to pose, because this is not a law lecture, but an ethics lecture, is why is that? Why would you allow public health professionals to infringe on individual liberties in that way? What is the ethical principle that allows that to happen? And for that, I want to call on the original libertarian, a guy named John Stuart Mill, who said very famously, and this is called the harm principle, the only purpose for which power can be rightfully exercised over a member of a civilized community against their will is to prevent harm to others. In other words, your liberty to swing your fist around ends at the tip of my nose. Right? You have the liberty that you wish, but you may not disobey stop signs, because doing so, although it would be, your liberty to not pay attention to speed limits or to not pay attention to stoplights, you must do that, and the state can enforce that because it's a protective thing against you accidentally or intentionally harming someone else. This has been repeatedly litigated. The most famous case here is the Jacobson versus Massachusetts case in 1905, where they talked about public self-defense. And I put a quote here. It's a very short decision, by the way. If you're interested, you should go look it up. It's 1905, Jacobson versus Massachusetts. And they argue that real liberty actually requires that the state be able to prevent people from harming others through their exercise of their personal liberty, that persons and property may be and should be subjected to restraints and burdens if they're necessary to secure the general comfort, health, and prosperity of the state and the other people around you. The problem, of course, is that smallpox vaccination, which is what the Jacobson case was about, can be extended in a variety of ways. So here's an infamous Supreme Court case from only 22 years later, where they say the principle that sustains compulsory vaccination is broad enough to also cover forcibly sterilizing someone. And the infamous quote here is 3 generations of imbeciles are enough. But I like to highlight this part about compulsory vaccinations because this was a public health law, and it was interpreted as a public health law. And they're basically saying here that the state can forcibly sterilize someone in order to prevent her, in this case, from having babies who they assumed, based on eugenics theories, those babies would become wards of the state and would cost the state money, and other people would have to pay for them. And right, that kind of thing. So this is, to our modern eyes, this is a clear overuse of the public health police powers. And so I'll just say every issue that we have dealt with over the last few years with COVID has been within that spectrum, right? Where does a face mask requirement, where does quarantine, where does a business closure sit in that spectrum between being a clearly reasonable infringement, like requiring smallpox vaccination and enforcing it with a fine, right? So no one's tying you down to give you that smallpox vaccination. You have to pay, in that instance, it was a $5 fine. That would be about a $300 or $400 fine today. So, could a vaccination requirement for COVID enforced by a $400 fine, could that be constitutional? Or is, that an overreach of public health police powers, like literally forcing someone to be sterilized, tying them down and sterilizing them against their will? There are a variety of reasons why people call on the state not to infringe on liberties, even if it may have some adverse public health consequences. This is obviously an infringement on liberties, but things like mask mandates or vaccine mandates are also seen as alienating and disrespectful. They are the first step towards fascism, if you want to go that far, right? There are those ideological objections. There are also, though, pragmatic objections. So with vaccination, for example, there are sometimes arguments made that voluntary efforts at vaccination might actually work better than mandating. And that if you have voluntary efforts, then you are forced to go out and educate people and try to convince them in a reasonable way to get vaccinated, as opposed to relying on a vaccine mandate, which could actually call attention to the fringe people who are really who are objecting on these ideological grounds. And it's possible that a mandate could actually backfire. It may be that you get people who say, you're not the boss of me, you can't tell me what to do, and I won't be vaccinated, even though I might have been vaccinated had you not implemented the vaccine mandate. So the question, oh, sorry, these are the things that I was just talking about in terms of the vaccine mandates and possibility of backfiring. This gets to the point that restrictions on liberty can depend on things that you might not at first think of, right? So a quarantine obviously will be more or less effective depending on biological things like what is the latency period of the infection, how transmissible is it, are people infectious before they are symptomatic, etc. But it is also related to a bunch of social characteristics. How trusting is the community that you're talking about asking to go into quarantine? Will they accept the quarantine? Will they try to flee from the quarantine? Who's affected? Is it the empowered people? Is it people who are, more likely to feel like I've been disadvantaged repeatedly and now you're asking me to do yet one more thing? Do you have the capacity to live under quarantine for a while, or do you have to go to work? All of those social characteristics will also make your quarantine or any other restriction on liberty more or less effective. So you might wonder, could a quarantine actually backfire? And unfortunately, we actually have a number of examples where quarantines have backfired. In the SARS epidemic, for example, there was a rumor that all of Beijing would be quarantined, and 245,000 migrant workers fled the city in advance of the quarantine. In Hong Kong, at the Amoy Gardens apartments, they were rumored to be about to be quarantined, and when the police got there, no one was home in half of the apartments. This was at the outset of the SARS outbreak in Hong Kong. And of course, with COVID, you may recall that Wuhan, China is a city of about 11 million people. At the time of the lockdown in mid-January, there were only about 6 million people in the city. So half of the city was not there by the time the lockdown happened. So people will sometimes flee in the face of what they think is going to be a mandatory quarantine. This is why in this consensus report for the national academies, this came out just at the beginning of COVID. So it was not about COVID, it was about these other examples. But one of the things that we noted in this is that people who fear being placed in quarantine might actually flee the area, and that could potentially spread the contagion further than it might have spread if you hadn't threatened them with a quarantine and caused them to leave town in advance of the threatened quarantine. That said, as I said at the outset, this is complicated. There are multiple mathematical models, and our experience during COVID actually showed even a leaky voluntary quarantine can help by smoothing the epidemic curve, and there are relatively high public acceptance rates if people are asked to quarantine, to voluntarily self-quarantine. That actually can work. And compared to other non-pharmaceutical type interventions, so not vaccines and medicines, but other ways of trying to prevent the spread of illness, like mass screenings, those turned out with SARS to be extremely ineffective. And in fact, some SARS cases in China were linked to exposures that took place while people were standing in line waiting to be screened. So there are not a lot of really effective non-pharmaceutical interventions, and we have to take them all seriously in the context of a public health outbreak. Last slide, who panics and who protects? I just want to make the point that, these are complex calculations, and it is sometimes said, and Edelson calls this a canard, that in the event of an emergency, the public will panic. That is actually not very common. For the most part, during public health disasters and emergencies, the public tend to come together and communities tend to strengthen during public health outbreaks and other disasters. They tend, in disasters, the research shows, to be more cooperative and more generous than average than normal. It is political leaders who may be the ones who want to respond forcefully or downplay risks. They tend to exaggerate risk or downplay risk depending on their sort of political bent and what they think is going to help. So for example, during Ebola, we saw governors sometimes implement quarantines that were really not scientifically justified on the basis of public health metrics, but they wanted to reassure the public that they were doing everything they could. And of course, many of us feared that those inappropriate quarantines might actually make the outbreak of Ebola worse by preventing people from the US, for example, from going to Africa to help respond to the outbreak and bring it under control. And of course, in COVID, we saw some of the opposite, where political leaders downplayed the risk, while the public health community was the one trying to say, wait a minute, this is a lot more scary than you're making it sound right now. We should be getting people to wear masks, to stay indoors, et cetera, or to stay, in low transmission settings. So there is a special obligation of public health professionals and responders to argue for the appropriate use of police powers in a crisis, recognizing it can be overused and it can be underused. So again, these can work, but they need to be justified both legally and ethically. We have historical examples of them taking too far and also of them backfiring. And we have a special responsibility to do the calculations, to figure out when restricting liberties is likely to work and how to implement those restrictions in the least restrictive way so that people are more likely to adhere to the restrictions that we're putting in place. All right, so that's the end of part 2. Part 3, we will talk about scarce resources. And again, I welcome you to send me a note if you'd like to communicate more about this, and I'll see you next time.